Well, we all want to keep our brain health as we get older, but new findings suggest the amount of muscle mass can actually make a difference.
New research shows that there are people with higher muscle mass as well as a lower visceral fat to muscle ratio tend to have younger brains. So we've brought in 9 News medical expert Dr. Payal Kohli to help us understand this a little bit more. So the first obvious question is, what is visceral fat and how does it relate to our brains?
Yeah, I've never heard of visceral fat.
Never heard of it. Well, now you'll think about your visceral fat after this. All right, so as we get older, our muscle mass starts to go down. Any guesses as to what age that starts to happen?
28.
30s.
Probably younger than you think.
30s, yeah. So we start to lose muscle mass. Instead, we gain something called visceral fat, which is not the fat you can pinch under your skin. That's called subcutaneous fat. Visceral fat is internal body fat. It's fat around our organs, like our liver, our pancreas, our intestines. And what it does is it's actually metabolically active. So it doesn't just sit there. It actually confers risk, type 2 diabetes, dementia, as we're learning, cancer, and all sorts of other problems as well.
So you mentioned a little bit about the difference within the fat, right? What about, how does that compare to BMI?
Yeah, so BMI, body mass index, it's a simple measure of our height and our weight. Do you guys know your BMIs?
I have no clue.
I probably should, but I don't.
I do.
You should.
I should too.
So it's a great way to screen the general population, but you can imagine a football player, one of the Broncos, has a lot of muscle mass. So his weight to height ratio might suggest an elevated BMI, but he's not actually fat or unhealthy. Similarly, an older person can have very low muscle mass, but a lot of fat, and their BMI could be normal, right? Because the fat is making up all the weight. We also have a classification of people called TOFI, thin outside, fat inside. So you look thin,
that's me.
Your BMI measures normal, but you have visceral fat around your organs that confers risk, and metabolically, you have a target sign on you to have a high-risk outcome.
We're having this conversation. I'm just thinking back to how much I ate yesterday.
Yep, we all are.
These are things that happen over time, right? It's not like, oh, I had a big meal or I'm eating unhealthy for a couple weeks. Like, this is something that builds up over time. Is that fair?
Absolutely, yes. And so a lot of factors go into how much visceral fat you have. So of course, aging is one of the biggest factors of having excess calories. So if you have an increased BMI, it does correlate with extra visceral fat, but it's not all genetics and it's not all aging. A lot of it is within our control. So how sedentary we are, how much sleep we're getting, how much stress we have.
Lifestyle things.
Cortisol, yes, which is great because it means it's all modifiable. But a lot of us don't stop to think about our visceral fat. We just are so fixated either on subcutaneous fat or that number of the BMI that that's what we use to predict our risk.
I'm so glad that we're talking about this because when we began the segment, I had never even heard that term before. And in this new research, is there a ratio between your lean muscle mass and the visceral fat? Like what do we want to target for?
Yeah, so your lean muscle mass goes down as you get older. I told you that, unless you do things to keep it up, like weight-bearing exercises, and the visceral fat goes up. So they looked at the ratio of lean muscle mass to visceral fat, and the people that had more lean muscle, less visceral fat, their brain ages were younger.
Really?
So now we're not just talking about heart disease and cancer and diabetes and high blood pressure. We're talking about keeping our brains young, which is something that is the holy grail of medicine.
Yes.
We're still trying to figure out how to do it, yeah. So this means, though, now in our 20s and 30s, before we start to lose that muscle mass, and even as older adults, we can start to do things to change that ratio. Now, you guys may be asking me, how do I
do it? That was my next question. It's like, we're talking about this. How do I make sure that I stay healthy?
Right. So you have to know what your visceral fat is. And the best way to know that is something called a DEXA scan, which is like an X-ray that basically tells you. You can also get an MRI, like a liver MRI or intestines MRI can tell you. In this particular study, they did a total body MRI. That's not practical for many of us to do. Those machines that you get at the stores or online for Black Friday that tell you how much fat you have, they're hit or miss, but you can start to use those as rough tools. But at the end of the day, no matter whether you have extra visceral fat or not, if you're thin outside, fat inside, it doesn't matter. Every single one of us needs to do at least 3 days of muscle conditioning activity, because that's how we're going to age better. In fact, how much muscle mass we have directly predicts our frailty as we get older, our fall risk as we get older, and many other outcomes that put us at risk for having bad things happen.
Really important, Dr. Kohli. Thank you for bringing this up today. And your brain, got to protect your brain especially.
That's right. I'm going to go and do some free weights, get some Black Friday weights on sale.
As I brought an extra slice of pie for dinner tonight in my lunchbox. Lovely.
Dr. Kohli, thank you.